Okay, here's my hip assessment. Oh, you can't see my feet. I gotta move this down a little bit more. There we go. Yeah, okay. So, here's my dog place. Okay. To start off your hip assessment, you're gonna wanna look at the patient's gait, making sure that their walking is smooth and rhythmic. And then you're gonna wanna start your inspection and palpation. You're inspecting for symmetrical shape and contour. And then palpation would be for any tenderness, pain, masses, and swelling. And then you're going to want to start with your assessment. So you want to find your hip joint or your patient's hip joint. They can either be laying down or standing up. If they're standing up and having trouble balancing, you can have a chair beside them and have them hold on to the chair. So you're going to want to start with flexion and extension. So flexion is just bringing the knee up and bringing it down, and extension. It's just keeping it straight, and you're really feeling for no crepitus, or making sure that it's a smooth feeling and it's not like popping for all these movements. And then next will be abduction and adduction. So abduction is going to be, you're going to be bringing that leg over the other leg. I'm having a hard time balancing. And then abduction is you're bringing it outside. And then hyperextension is when you bring it all the way back and you just keep it straight. And then external rotation and internal rotation. So internal rotation is when you bring the foot inside, facing the other foot. And then external is outside. And then when that's all done, you're going to be putting resistance on the patient's movement for testing their muscles. So the first resistance is going to be on the thigh, upper thigh, and you would push down for flexion and extension. And then the patient would just move their foot up. And then abduction and adduction. So abduction you put on the inner thigh. When they're going over, you apply resistance. And then adduction is when you're putting it on the outer thigh. And when they do that, you're going to put resistance out. When they move their foot outwards, you're going to put resistance. And then that's all for the resistance, because you can't do it for internal or external. And I think I'm pretty much got it all. I just want to make sure I have it all. I did my descriptors. Okay, yeah. And that is my hip assessment. Hope you enjoyed. And here's a quick video of my dog if you want, just because I know you like him. Hey, Chip.